am here in New Lotus Medical Center, which is situated in the heart of Dubai, Kisses Damascus Street, as you all know. And here I am honorably welcoming the doctor who has completed almost 8 years in this field. She started in India and reached here. Dr. Soumya Harikumar. Talking to her, it was her passion to become a doctor. That's how she reached here, with a heart desire to serve people, to serve patients who are in pain. She is a gynecologist by profession, so I'm here to talk a lot about women health and what all lifestyle diseases we are facing nowadays in this era. So I hope it will be a healthy discussion as well. So before we start this Safalamee Yathra episode, I would like to welcome Dr. Soumya Harikumar to the episode. Hello ma'am.
Hi.
How are you doing today?
I'm good.
I know you have a very hectic schedule. So without wasting our more time, I would like to begin from the time. How come you chose to become a doctor, or how come you chose this specialization, that is gynecology?
Because when I started, I did have the idea of being a doctor probably from school. I always wanted to take up MBBS because I wanted to do gynecology. Concept of giving, help to mothers to deliver a baby was always fascinating. So I chose gynecology. I never had another option.
Yeah,
it was always gynecology.
This was the only first and last option you had. And you studied in Trivandrum.
Yes, Gokulam Medical College.
And after that, how your career started in Trivandrum, or which part of India?
No, I actually did my MBBS from Trivandrum and post-graduation in Karnataka, in K.S. Hegde Medical College, which is located in Mangalore. Followed by my residency in Alleppey Medical College, TAD Alleppey. And then I did my 3 years post that in Pushpagiri Medical College. So it was almost 3 to 4 years in India, and I must say that I was quite lucky to work with quite renowned doctors. Even if it was Alleppey also, my HOD was quite a well-known doctor called as Dr. Lalita Ambika. She's quite well-known. And then followed by that, Pushpagiri was another very famous doctor. She was an ex-HOD from Kozhikode Medical College, Dr. Sridevi. Okay. She also happens to be my father's first cousin. So I got the great opportunity to work under her for about 3 years. But after that, COVID struck, and I never had the plan to leave India, to be very frank. But my child was very small. He was only 6 months old. Quarantine was taking a lot of, because I was stuck in the hospital for a long period of time. My mom couldn't manage. My mom and me were stuck in Kerala. My sister is a pulmonologist by profession. Though she's practicing, she's not practicing now. She's into business with my father. So she was stuck in Mangalore because she was a pulmonology resident that time, and she was, actively working for COVID at that point of time. So, sometimes life doesn't go the way you plan. So we had to move because my father was stuck in Dubai. So we never wanted to stay apart. So we took the collective decision to come to Dubai at that 4 years back. Now here we are.
So just to conclude, Dubai was never on your books?
For practice-wise, never on my, because I always prefer to practice in India. Even my husband, but then sometimes, you do things for your family, your child, what is better for them, and COVID was a decision-making point for us. Yeah, when practice started, I didn't have the plan to leave Kerala, to be very frank. But then Dubai is always home. I was entirely raised in Dubai and Saudi. I did my schooling entirely till 12th standard in Dubai. So Dubai is always home. But yes.
Before talking more about New Lotus Medical Center, which you have joined like 3 months back, you have acquired it, I would like to ask a few questions about the women health. So what are the lifestyle diseases which are commonly seen here, and what are the things we can just take precautions, or we can do a few things or changes in our lifestyle so we can stay away from
that? That's actually something that is not quite unknown. Actually, people, because of social media, they do have, let me be very frank, not a complete idea, because I think social media is making people more confused these days. But polycystic ovaries becomes one of the most prominent health issue that is affecting a child as young as 10-year-old. Even you find children who just attained menarche, that means the first time periods, following which they never have a proper cycle, and they are diagnosed with it was called PCOD before, now it's called PCOS. It's become a syndrome. That's one of the most commonest lifestyle problem, and followed by other things like infertility and obesity, and which is giving rise to early development of hypertension and diabetes. But I think things will change because now people are more conscious about obesity. People are into weight loss drugs like Mounjaro and all that. So, but I'm not saying that is definitely the management, but drugs are always this one. People are aware of drugs now, so I think.
What is the right age, or from what age a girl should start consulting a gynecologist?
Most of the time, we encounter a woman when they are in their reproductive age group, right? But that it's not limited to that, because we have these issues like PCOS starting as early as school-going child. I have treated PCOS from as early as 11-year-old. You have children who have already got their periods, following which they don't get, and then when you evaluate their hormones, it might be deranged. I have children who have never gotten periods for they're 16 and 15 and all that, and some of them have not attained menarche. That means periods, the first period. So as early as school-going children are being seen by gynecologists. Sometimes they do present with excessive hair on, facial hair, acne. So dermatologists might see them first and then refer. So PCOS always is one of the first things that comes. And of course, the knowledge about cervical cancer and therefore the injections like Cervarix and Gardasil, which is given to prevent HPV infections, is given for young children, young girls and boys. So even those kids do come and consult a gynecologist for taking the vaccination. But as far as age is concerned, we go up to menopause. So
nowadays we come to see through so many social media posts or some doctors' interviews that breast cancer checkup or pap smear, these are the few things you should continuously do in 6 months. So just doctor, why this was not there before, but now the cases are increasing. So is there anything from which we can prevent?
Actually, you cannot say it is increasing. You can say that screening has gotten better. We are detecting things earlier. Just like you will find a lot of people dying of cardiac arrest all of a sudden. That's probably because the reporting of through social media and your might be there before as well. But now your media is so strong that every case is being reported. Similarly, screening has improved a lot. Now women are aware about their health. Women are getting their health checked, their blood test done, their BP monitored, they're getting their pap smear done, they're getting breast examination done by doctors, or they're doing a self breast examination every month. And thanks to even if you notice, if you are interviewing me now, how many doctors would have interviewed regularly maybe 10 years back? So now, since social media and your TV or whatever form of media you have, doctors are more prone to talk about it. So because of that, people are more aware about it. So you have both sides, right? Because of the screening, you are finding out that there are more issues. You are finding it at much earlier stage, so the cure rates are better. So this is how you, even if you are talking about breast cancer, or if you're talking about pap smear, like your cervical cancer, they're all screened now. So I have women regularly who come to me, and they do get advice. Before, the concept of hormone replacement therapy, which is usually given for menopause, was not very widespread in India. It was very active in the Western countries, but it was not very active in India. But thanks to the media, now women are aware that they can have a good life even after attaining menopause. They can have a fruitful life after attaining menopause. So why not? So you meet a doctor at that point of time and get information about it.
Now, as we can see, the technologies, the AI is all over the world, all over, in all the industries it's there. So basically in medical industry also we have implemented a lot of AI uses here. So in gynecology or in this in this specialization of hospitals, how come AI is helping?
See, AI is something that is the future, right? Now, if you take into consideration the Arab Health Week that happened in Dubai this year, had a major segment covering AI. Your ultrasound machines are incorporated with AI, which makes your imaging much better. I think, I would want a future where both AI and human beings go hand in hand, rather one taking over the other, because human expertise is human expertise, right? Every human body is different. AI works on algorithm.
Yeah.
Okay, so it is still something that we have to look forward. It is our future, no doubt about it, because now laparoscopy age is over. We are into robotics. So robotics is doing, doctors are into robotics and they're doing wonderful cases. We have great surgical results. The hospital stay has reduced a lot. The post-operative care, the time for recovery has reduced a lot because of robotics. So of course AI is the future, but I don't know if it will completely take over human expertise. That is something that we should be worried about also, to a great extent. Yeah. But yes, it is our future.
But if it is going hand in hand, so
why not? Because precision is something that algorithm can give you. Human errors will be reduced to a great extent when there is AI. So even though the saying goes that to err is human, to forgive is divine, that doesn't you cannot practice when it comes to healthcare. So I think.
And also we are from India, so we from childhood only, we being girls, we have heard a lot of misconceptions, and not only that, so many myths about women health. Myths as in like about are getting pregnant, if you're on periods, you're not supposed to do certain things. What would you like to say about it?
From a cultural point of view, there might be so many things that is actually true, right? But there are so many myths also that cannot be accepted. But then there are certain things that you shouldn't question. So I believe in don't question your grandmas, let it be.
Let it be. Being a doctor, there are situations when you face certain challenges that you will always remember in your life. In the same way, what rewards you have found in your whole
actually when
career?
You come to a career wise, I'm still a very young as in very young to the field of medicine, right? It's been only 8 years post graduation, but I think when any patient, as a gynecologist, I think the most rewarding thing is when experience of motherhood, when you treat a patient for infertility specifically and they come back to show you their baby. I think that is most rewarding for me. When career wise, I like more of obstetrics than gynecological part of my field. I am specialized in laparoscopy, but even then I like my obstetrics, because as I said, gynecology was taken up because of that part. So when you make a patient pregnant with infertility treatment, I'm not an infertility specialist, but our basic infertility treatment do work sometimes. Most of the time, thanks to God. So when they come back with a baby, yes, that's one of the biggest rewards as a doctor you can give. I don't think Google review will have that much power.
So I would also like to talk about New Lotus Medical Center. Like you were working with another clinic here in Dubai for almost 3 to 4 years, and then you decided to acquire this. How come that idea came up, and what all doctors are present here at present, so that people can just come and have a good treatment?
Why not? Because at the end of the day, you should talk about this is actually something that has been a passion, because healthcare, my father is my mentor. Let me be very frank. I'm sure everybody knows him. His name is R. Harikumar. He's the managing director of Allied Group of Companies. So keeping all that aside, I think he has always told me that not only me, anybody who has taken up medicine, me, my sister, my husband, her husband, that never practice medicine to make money. There are other means to make money, but when you're practicing medicine, don't think about making money. So, and this is a thing that he has always told us, because we were always told not to become doctors. Let me be very frank, because I come from a business background, and everybody, any relative, be it anybody, said, why you want to go for all this? Even my professors has told me, Soumya, you could have actually, why you, this much hectic job, why you want to, but then my father is someone who never stops us two girls from doing whatever we have wanted to do. So this is my baby. This is concept is my baby, and I like to give my 100% when I'm with my patient. And I think I can vouch for the fact that 4 years I've practiced in Dubai, or my patients, if they find, if you find my patient, they'll tell you that I talk to them, I listen to them. So I think that is what every doctor should do. If you are able to listen to a patient, you
That
will
is the
get
best remedy
because
for
at this
patient.
point of time, what people lack in this current fast-paced life is there is nobody to talk to. So if you're seeing limited number of patients, also spend time with them, listen to them, so that you are able to process what their problem is. If you're not able to listen to them, if you're not able to give your thoughts into that process or that conversation, I think you've failed as a doctor. To ask me a question in the beginning, there are so many young girls who are single, who is coming to Dubai, who are having lot of health issues, to be very frank. As early as 21, 22, I do get a lot of patients. Lot of couples who are facing with infertility. And the worst part is there is no reason for this infertility. Before there was a reason. Girl had this problem or boy had this problem. And now you have unexplained infertility cases, and which becomes more difficult for us to treat. So stress factor becomes one of the major reasons for that.